Hello, welcome to the Polk County Health Center Plan for Technology. First, let's review our mission statement. The Polk County Health Center commits to leading by example in healthy lifestyle choices and providing healthy lifestyle options for all residents of Polk County. We're going to talk about how our technology and a budget for technology will aid in helping us meet this mission statement. So there are gaps in the services that we can provide to the public due to our limited technology resources available. So that is the problem that we aim to solve. We're going to do that by developing a 3-year technology budget plan. Our team is going to consist of our administrator, a board member, our supervisor. We have 3 supervisors, our technology director, our health educator, a community member, maybe a couple, our marketing representative, and then our equipment manager. Why do we want each of these people as a part of our team? Obviously, our administrator is going to oversee the selection, purchase, and implementation of the technology as well as the funding. It would be good to have a board member on our team to monitor discussions, communicate to the remaining board members, and just aid in our decision making. We have 3 supervisors currently on staff, and they would need to be a part of the team and attend train the trainer sessions, as well as train their staff, master the software and hardware that we purchase, and then troubleshoot any application problems or implementation and monitor the usage of that technology. Our technology director will be kind of our administrator's right-hand man and assist the administrator in researching and selecting the technology, purchasing and finding funding for the technology, and then lead in training and implementation. The health educator should be a part of our team because the health educator will be using the technology in communicating with the community on different health topics, whether it be through social media or the website or at school or community presentations. So the health educator will also have some say in the compatibility elements that need to be present so that those presentations can be done in the community. A community member would be great to have on our team to represent community needs, to act as a liaison to other community coalitions, and hopefully assist with fundraising. Our marketing representative also needs to be a part of our team. On the internet side, the social media and our website, to make sure that our new technology will be compatible and also be able to communicate any new technology apps that might work well for us to communicate with the public. And then our equipment manager obviously needs to be involved so that we can ensure that we will have compatibility with systems that we already have in place, assist with purchasing the new equipment, overseeing the installation and maintenance, and then also reviewing the warranties that are a part of that system. So our goals and objectives for this 3-year plan, right now in March of 2019, we have limited technology options. So within a year, maybe a little over a year, we would like to see that change. So beginning in June of this year, 2019, we will form our team, let them know what our goals are, restart researching funding, and increase our current technology use by becoming familiar with what we have available, and also working with our marketing representative on what we can do to increase our communication with the public through what we currently have. Then by July of 2020, we would hopefully be able to purchase the electronic record system and our telehealth equipment, and then see some increase in our social media presence and also the use of our website. And then by September of 2021, hopefully have a Polk County Health Center app that can be used so that it's easy access to telehealth and our other resources, and then full use of the electronic record system be available as well, and telehealth be used at least 60 times a month by that time in 2021. So in summary, our goals for 2019 to establish the social media presence, present in all school districts during the summer school time so that we are increasing our presence in schools, monitor our traffic on the website to know what most people are using the website for, gather 3 telehealth system models for examples, and then obtain bids for our electronic record system. In 2020, our goals would be to continue to increase our social media presence and add to the applications that people can use to get information. For instance, adding an Instagram account, using our Twitter account more, and then also presenting in all school districts monthly in some format, updating our website with links to any of our new social media apps, and then purchasing and implementing our telehealth systems and our electronic record system, and begin the transition of our current paper records to the electronic records. In 2021, we hope to create and implement the PCHC app, and then continue our presence in all school districts at least monthly, update our website with links that include our app, our new app, and the telehealth link. And then, as I said, we'd like to see at least 60 times a month the telehealth option being used. And then by September of 2021, the electronic record system being fully used. Our budget, year 1, currently our budget's $15,000. In year 2, it would need to increase to at least $100,000 in order to make those purchases. And then in year 3, it could come back down to around $64,000. In year 1, the money will be spent with staff development at $5,000, internet access $1,800, materials and supplies $1,200, equipment costs $5,000, and maintenance costs $2,000. This is mostly because we're doing just basically research during this time, and that is included in that staff development amount. So in year 2, staff development increases to $18,000 because we're going to be training staff. Obviously, our equipment costs will increase to $90,000 in order to purchase the telehealth system and the electronic record system. And our maintenance costs are going to go up because of the installation and setting all of the hardware and software up as well. And then in year 3, hopefully most of the staff will be trained by then. So there'll be still an increase due to maintaining those new systems, but it can decrease a little bit. Our equipment costs will come down a little bit, but still, because of maintaining those systems, we'll have an increase there. And then our maintenance costs will come down a little bit as well. So our existing resources, we have plenty of desktops, tablets, iPad, and maintenance staff, but we're going to need to update almost all of that. Our new software that will be necessary will be the electronic record system, the telehealth system, and then an application for smartphones. And these new programs are going to make information more readily accessible primary care easily available, personal information more secure, and communication accurate and timely, and hopefully reduce the number of ER visits, which will, in long term, decrease our overall healthcare costs. To evaluate our new software products, we'll take into consideration the cost, the compatibility with current hardware, the tech support that's provided, training that's necessary, the ease of use for our staff and clients, and then time management. How much time will it take to get all of that set up? Our top 3 criteria for our software will be cost. Unfortunately, that's going to be a major one. Compatibility, and then the tech support that's available. When we're thinking about installing and updating and troubleshooting, our 3 primary go-to people will be the administrator, our technology contractor, and then our technology director. And technology contractor and our maintenance director are basically the same person. And then as far as hardware is concerned, we're going to need to upgrade at least 7 desktops, maybe more, new hard drives for all of those, and then possibly additional hardware that I wouldn't know about until we get the bids and research the information for the telehealth and the electronic records. How will our new hardware meet our mission statement? Well, obviously it's going to support the electronic record system and the telehealth, which are going to provide secure and timely and accurate health information to Polk County residents, which reduces our overall healthcare costs, which is one of our goals. We'll evaluate our hardware again by making sure that it's compatible. We also want to make sure that there are upgrades that are available, or that upgrading will be easily done, that there's a warranty on our hardware, and that it's good, and that the hardware is cost effective, and that it's accessible and user friendly. Our top 3 criteria for our hardware will be compatibility, the upgrades, and the warranty. Our technology contractor will be a huge influence in our decisions, as well as our administrator and technology director, but we'll rely heavily on the knowledge of our technology contractor to know whether or not the hardware is a good fit for what we want to do. Professional development. Our coordinator will be the administrator and the technology director. In the first year, we'll focus on social media marketing, school topics, and the PCHC app training. And then in year 2, we'll continue with the social media apps, because we'll be adding those, and we'll start with the electronic records training and the telehealth training. And then in year 3, we'll update anything that needs to be updated as far as the apps are concerned for the health center, and then continue with the electronic record training. Proficiency expectations. We would like for the administrator, the director, and all of our healthcare providers to have mastered the new technology, and then our nursing staff to be at least proficient with the use of the telehealth and the electronic records. To evaluate our progress, we will, during the first year, do an informal evaluation during staff meetings. We'll also implement a community survey and suggestion box. We will encourage client reviews on our social media and websites, and then also monitor client or community referrals to our health center. In year 2, I'm going to pause right there, and we will continue on in the next video.